Nowadays, the Alzheimer's disease is the most common form of dementia and it is incurable. The number of the people living with the Alzheimer's disease is continuously increasing. Around 33 million people is currently living with the disease. According to the progressive loss of the nerve cell, these patients suffer with memory loss, orientation, and no longer manage their daily life independently. As a result, the quality of life of this patient and their relative is considerably reduced. So this is a new technology in the world for helping these people. It is transcranial pulse stimulation, or TPS. The TPS is a device for the patient who had the symptoms of mild to moderate Alzheimer's disease, and it has been CE marked or approval by European countries since 2018. The mechanism of TPS, the TPS is involved control transmissions of acoustic pulses through the scalp and scalp. It deep into the regions of the patient's brain typically affected by Alzheimer's disease. It deep into the deep brain structure about 8 to 10 centimeters. And the purpose of the mechanism, number one, it can promote micro blood-brain circulation. Number two, increasing nitric oxide, which help for the blood vessel dilatation. Number three, stimulate BDNF, or Brain-Derived Neurotrophic Factor. It's like a growth factor in the brain for regeneration and neuroplasticity. The procedure of the TPS is very easy, uncomplicated, friendly user, and all the patients are not necessary to shave their head. Before TPS begins, the physician applies the gel on the scalp, then a pair of glasses are put on the patient to enable the position of the head to be detected. During application, the physician will gently move the handpiece around the head. A session of the TPS is last about 30 minutes, and the initial protocol of TPS comprises of 6 sessions for over 2 weeks. By the way, the TPS might helpful for this indication. For example, number one, mild cognitive impairment. Number two, brain fog or low attention. Number three, post-COVID-19 syndrome. Number four, autistic spectrum. Number five, mood disorder or the ADHD. Number six, sleep disorder. And the last one, migraine headache.